and facts about HPV. I think each and every gynecologist and they in turn can tell the nurses and the medical officers about HPV and thereby the HPV vaccination. These are small things, but I think we should talk the same language, and that is why these slides are shared. I wish to tell you that in any community programs, whether it's anemia, the government has made the slides. The similar way for cervical cancer Mukt Bharat, we have to also make a slide. On the similar way activity we have done on when we talk about eclampsia mission, zero eclampsia in our practice and zero mortality in eclampsia in our practice. Again, our emphasis is that everybody is exposed to the same knowledge and the same set of slides which has been given to you in the ebook. So on the same lines, these things are there. All the slides which I presented on 14th and today will be passed down to each one of you. Myths and facts about HPV related cancer and its vaccination. Everything you need to know about HPV as a doctor. What is human papilloma virus? हमको बहुत लंबी चौड़ी बात याद नहीं रखनी, थोड़ी सी बात याद रखनी है. Human papilloma virus is a sexually transmitted virus. Like all viruses, HPV causes infection by entering in the cell. There are many different types of HPV. Some types can cause serious health problems, including genital warts. As you all know, there are 15 oncogenic viruses which are known to cause cancers in the genitourinary area. I will talk about in detail. It is one of the most sexually transmitted viral infection, HPV. The data suggests that almost 80% of unvaccinated adolescents and adults will have HPV infection at some point in their life. Therefore, protection against HPV is very important before they indulge in sex. Human papilloma virus infection is usually acquired through direct skin-to-skin contact during intimate sexual contact with someone who is infected. The virus can be transmitted by penetrative as well as non-penetrative sexual contact, vaginal, anal, and the oral sex. A person with HPV can pass the infection to someone even when they have no signs and symptoms. Data suggests that women are at a high risk of almost 30% acquiring HPV infection from the single male partner within 1 year of intercourse, and with the risk of increasing to 50% by 3 years. So this particular part, they must know about it. Many people, including gynecologists, say that we have a single partner, why should we take vaccination? And this answers them that by the end of 3 years, 50% are HPV infected. What diseases does HPV cause? High-risk HPV types can infect cervical cells and cause cervical cancer. In the similar way, they can cause anal cancer, vaginal cancer, vulval cancer, and high-grade dysplasias. Low-risk HPV types can cause genital warts and a low-grade dysplasia. Genital warts do not turn into cancer. Denmark study shows that these people who are infected with genital warts are prone to have it, but because for genital warts you take vaccination and also so prevention is there, so full form of florid cancers are not seen. What diseases does HPV cause? It is the persistent infection. I repeat again, it is the persistent infection is the most important risk factor for a disease progression and the development of cancer. A lesion that develops as a result of HPV infection is also known as central intraepithelial neoplasia. Many times I ask, what do you mean by CIN? So they must know the full form is central intraepithelial neoplasia and is classified according to its severity. Eventually, low-grade lesion, that is LSIL, advances to high-grade lesions. Here I just wish to tell you, LSIL includes HPV infection and CIN1. while high-grade lesion will include CIN2 and CIN3, ultimately leading to invasive cancer. Tumors may regress in response to initial treatment. However, most cases of latent infection prevent complete clearance of the viral infection and eventually result in the lesion occurring again. The cause of reinfection time and again, our male partners, because the clearance at 30 years is seen to the tune of 60 to 65% as far as females are concerned. But as for the men are concerned, the clearance in them is around 30 to 35%. And that's why they are major reservoirs from where the ladies get infected again and again. What is dysplasia? Is it common in India? Dysplasia is an old term, refers to the presence of abnormal cell within a tissue or organ. Although not a cancer, it may sometimes progress to become a cancer. Dysplasia can be low grade or high grade depending upon how abnormal the cells look under the microscope and how much of the tissue or organ is affected. In fact, cytology has emerged as a big branch after cervical cancer screening is concerned. Low-grade dysplasia is characterized by early changes in size, shape, and the number of abnormal cells formed on the surface of the affected tissue or organ. High-grade dysplasia is characterized by a large number of precancerous cells on the surface of affected tissue or organ that are distinctly different from the normal cells. They have potential to become cancerous cells and invade deeper tissue. More than 30 million cases of low-grade dysplasia and 10 million cases of high-grade dysplasias have been reported in women globally. And this particular figure is of 2022. The data suggest that 2% women in India are at risk of developing cervical dysplasia, with the high-risk HPV types accounting for almost 28%, and that is low-grade, and 63% for the high-grade lesions. As for the genital warts are concerned, we all know about it. Yesterday, I told you the incidence is 1% in our country. The genital warts are growths that can appear on the outside or inside of the vagina or on the penis. The warts also can spread to nearby skin and can grow around the anus, on the vulva, or on the cervix. Genital warts usually appear as a small bump or group of bumps in the genital area. They can be small or large, raised or flat, or shaped like a cauliflower, which happens in pregnancy. And there is tremendous growth during pregnancy. The warts may cause itching or pain, or they may not cause any symptoms. A healthcare provider can usually diagnose warts by examining the genital area. How they need to be treated? Warts can be removed with medication or surgery. My advice to people who are listening me, if you give 2 doses of Gardasil 4 and wait for at least 2 months before you get onto surgical treatment, 80% of the warts will fall off themselves. When we talk about treatment, the warts remover should found in the pharmacy should not be used for genital warts. Please mute yourself, all of you. Is HPV common in India? Yes, about 7 lakhs people around the world.
Dr. Preeti, आप mute कर लो, please.
Approximately 7 lakhs people around the world are diagnosed with HPV-related cancer each year. The human papilloma virus-related cancers are the second most common cancer in India after the breast cancer. The data suggests that at any given time, 6.6% of the women in general population in India are estimated to have HPV infection on the cervix. Is HPV common in India? Just now I told you that 6.6 to 7% is no less incidence. The incidence starts rising from 30 to 34 years, takes a peak around 50 to 65 years, with a median age of 38 years. This largely preventable disease is the second most common cause of cancer mortality among Indian women, accounting for nearly 1/4 of the world's cervical cancer deaths. So this figures how much India is contributing to the world kitty as for the incidence is concerned. As for deaths are concerned, we must exactly know. Every 5 minutes, one patient dies of HPV cancer in India, and every 8 minutes, one patient dies of cervical cancer in India. How long does it take for a cervical cancer to develop? Usually it takes 3 to 7 years for certain changes in the cells on the cervix to become cancer. But the research has shown that HPV infected cells can develop into cancerous tumors 10 to 20 years after the infection, or even longer than this. And therefore, regular screening and vaccinations are important. The purpose of cervical cancer screening is to detect these changes while they are still easily treatable. Women with high-grade changes can get treatment to have the cells removed from the cervix. The woman with low-grade changes can be tested over time to see if the cells go back to normal. Again, the WHO has given two kinds of guidelines where follow-up is not the issue. If the follow-up is not the issue, it is good to keep them on a follow-up as far as the low-grade lesions are concerned. But where the follow-up is a big issue, the clear guidelines have been given by WHO as far as the treatment is concerned. How can one avoid getting infected with HPV? Simple. Get vaccinated, get screened for cervical cancer. The routine screening for women world over is 21 to 65 years. But as you all know, that 3.1% people in our country are screened for cervical cancer. This data is of 23 by the government of India. So if we have to scale it up to 70%, then it is not possible for us to do every 3 yearly till 30 years and every 5 yearly if you're using a co-test up to 65 years. Why is cervical cancer prevention important to postpartum women? I told you just now that many times when a gynecologist happens to see a girl, she's already pregnant. So human papillomavirus may occur or persist during pregnancy because of the hormonal changes and decreased immunity. In fact, the incidence during pregnancy is little more than a non-pregnant stage. 19 studies have demonstrated that the prevalence of HPV infection is higher in pregnant women compared to their age-matched cohort of non-pregnant women, 17 versus 12, especially in Asian countries. India has the highest mortality rate of cervical cancer, that is almost to 60%, and which is definitely much, much more because our patients come stage 3 and stage 4 disease. Therefore, cervical cancer prevention during the postpartum period provides an important and excellent opportunity to prevent cervical cancer. The WHO organization aims at screening and vaccinating at least 70% of women by the age 35 years as a strategy to eliminate cervical cancer. And it is very much doable, provided we give away the idea of only pap smear or co-testing. We have to learn the art of VIA and VILI. VIA is 1 rupee test, VILI is 5 rupees test, and both take not more than 1 minute. Instant results are available. Which HPV vaccines are available in India? You name the vaccine, they are available. Bivalent, which was Cervarix, it's in short supply, not available these days because the government is insisting them to have a plant here. And quadrivalent and nanovalent vaccine by MSD is here. And now we know that our country's own vaccine is also here. Almost 140 countries globally have national HPV vaccination program. Our Ministry of Health and Family Welfare, Government of India too has recommended to include HPV vaccination as a part of the universal immunization program. And this will be rolled out by December this year. Do both HPV vaccination, quadrivalent and nanovalent, offer the same protection against the HPV infection? This question is often asked. मैं वही बात कहूंगी, अगर आप दूध में जितनी चीनी डालोगे उतना ही मीठा होगा. Bivalent vaccine and a quadrivalent vaccine As for the cervical cancer is concerned, it can eliminate to the tune of 98%. In biology, nobody can say 100%. So the place of nanovalent vaccine is between 98 to 100%. It's your guess what you're going to put it. Can I receive the HPV vaccination after childbirth? Big yes. Quadrivalent vaccine is recommended through ages of 9 to 45 years, and nanovalent vaccine is recommended in girls and women from 9 to 26 years. So if she is up to 26 years, she can take nanovalent as well as quadrivalent vaccine. Sarvavac cannot be given because they have never done a study in postpartum people. Is HPV vaccination beneficial after childbirth? Yes, the efficacy of these HPV vaccination is almost the same as you've taken before. What is the recommended dosage schedule for HPV vaccination in women after childbirth? If you are aged up to 26 years, either the quadrivalent or nanovalent vaccine can be administered, and it is 3-dose schedule, 0, 2, and 6. If you are aged 26 years and above, the quadrivalent vaccine only can be administered according to 3-dose schedule of 0, 2, and 6 months. My request to each one of you who is listening me, if you are using a nanovalent vaccine, it stops at 26 years. If you're using a quadrivalent vaccine, that is from the MSD, it stops at 45 years. But if you're using a gender-neutral Sarvavac vaccine, it stops at 26 years. For a girl or for a woman at 30 years, you can't give Sarvavac. You have to use MSD Gardasil 4. Can HPV be passed from mother to the child during pregnancy? Yesterday only we heard about HIV transmission, which is to the tune of 50 to 60% if antiretroviral therapy is not given. As far as HPV infection is concerned, though it is very rare from mother to child transmission, but HPV infection can pass through the mother to child transmission when the infant passes through the infected birth canal. There is no data available so far, but one can say it is rare. Can a woman who is breastfeeding receive HPV vaccination? Yes, just now we elaborated on it. How can one get tested for HPV infection? Please listen to me carefully. There is no blood test available to find out person's HPV status. I repeat again, there is no blood test available to find out person's HPV status. However, HPV test can screen for cervical cancer. Healthcare providers only use these tests for screening women aged 30 years and older. Human papilloma virus tests are not recommended to screen men, adolescents, or a woman under the age of 30 years. Any HPV-related tests should not be used in women less than 30 years. Do I still need to have a cervical cancer screening if I've had a HPV vaccine? Human papilloma vaccination helps it prevent HPV infection, but it's not a cure for HPV infection you already have in your system. Women who have been vaccinated still need to have a regular cervical cancer screening. Data suggest that combining cervical cancer screening with vaccination can reduce cervical cancer risk by almost 63%, not 61%. Talk to your health practitioner about when and how often you should be screened. Is HPV vaccine safe? Human papilloma vaccine is well tolerated and generally does not contribute to any serious health issues. The typical side effects are usually mild and include pain and the redness at the injection site, sometimes a very mild fever and a mild headache, which is temporary. Is the HPV vaccine safe in the postpartum period? Yes. The available evidence does not indicate an increased risk of adverse events linked to the vaccine in either the mother or their babies after administration of HPV vaccine to lactating mothers. What should I do if I got a dose of HPV vaccine before I knew I was already pregnant? So now the recommendations are there in case you are pregnant and you've had a dose of vaccination, no MTP. no MTP, and the remaining doses can be taken after the pregnancy is over. Can HPV vaccine cause fertility issue in the future? I emphasize the same thing again because this is a very common question asked. There is no evidence available that suggests that HPV vaccine has an effect on a future fertility. The other day, we also emphasized that not only you will use it in a postpartum period, you should also use this particular vaccine when people are coming to you for infertility management. So the day when she's coming to you, she's not pregnant. That particular time, this vaccine can be given. Do condoms prevent HPV-related infection? Please listen to me carefully. Human papilloma virus is transmitted through intimate skin-to-skin contact with an infected person during vaginal, penile, anal, or oral sex. You can get HPV infection even you do not have sexual intercourse. Therefore, condom use during sexual intercourse can provide some protection against infection. However, as condoms do not cover the entire skin surface that comes into contact during intimate sexual intercourse, they may not offer 100% protection. So that should be your answer. Do any national or international medical organization recommend HPV vaccination in postpartum period? This I emphasize on 14th again, that FOXC, American College, US CDC, WHO, and Pan American Health Organization all recommend HPV vaccination in postpartum period. Coming to my third part of my presentation today, counseling technique for HPV vaccination. Each one of you should empower themselves to answer all silly questions which the patient asks, the parents ask, and even the media person asks. My advice to you is for a media person, don't indulge in arguments with them. Why should gynecologists vaccinate for HPV? Very simple. Adult vaccination is catching up very fast. At this particular time, I told you the vaccination rate in our country for HPV is 0.1%. And the FOXC recommendations are that all gynecologists should be giving it. India has a huge female population from 9 to 45 years. 367 million cases are eligible for HPV vaccination, but most of them are not vaccinated. So gynecologists have a big opportunity for catch-up vaccination to this large segment of population. Third is, gynecologists see and treat almost all females from childhood till menopause, and hence they exactly know the damage caused by women by these infections, and ultimately to the family in case if there is a loss of life. There are various opportunities for gynecologists to discuss about HPV vaccination. I showed you in the beginning of today's presentation that no opportunity should be lost by the gynecologist as far as adult immunization is concerned and HPV vaccination is concerned. Some gynecologists may feel that the screening is enough for preventing cervical cancer. That's not true. Now, this particular slide is a very important slide. This study has been done by the ICMR. And you can see here, extreme right, this blue. If you give vaccination alone, 50% of the cervical cancer load can be brought down. And if you combine with 1-time screening, 2-time screening, and 3-time screening, you can add on another 30%. So it's a combination of vaccination and screening which does the wonder. So if you have to be, if you have given a vaccination, she has to have a screening, and if she's being screened, she has to have a vaccination. I showed the slide the other day, success story of the Western world. They had been using screening program, and they had brought down HPV infection rate in those countries by 70%, and deaths due to cervical cancer by 80%. And once they have added now vaccination in their program, they're on the verge of getting declared cervical cancer-free countries. And by 2030, there will be many countries will be there. Counseling patients for HPV vaccination is difficult and time-consuming. You should address HPV vaccination hesitancy question just like an elevator speech. In elevator, you are there for only less than a minute, and it has to be short, to the point. 15-second response should be there. 2 to 4 small sentences you should use. Make your message personal and emotional. It should be short, meaningful words and no signs. Look, I have taken it. My daughter has taken it. My all family members have taken it. It's my request. If you want to safeguard the health of your wife and your child, please take vaccination. So the words to be used for in counseling session should be, today your concern is to prevent cancer, 6 cancers. You want your family to be healthy, so keep healthy, protect them. Use we and our, together we can do it, benefit and love. Don't use words like sexually transmitted disease, immunity and percentage wise. Do I need to vaccinate if my patient is already positive for any HPV serotype? This I had told you that fortunately 0.4% of the sexually active women are infected with 4 viruses which are part of the Cervavac or quadrivalent MSD vaccine. And that is why 99% and more women will benefit from HPV vaccination. Majority of the sexually active women can get benefit from the HPV vaccination. That is the clear message. When physicians propose HPV vaccination for adolescent girls, the usual reaction is, my daughter is too young and not yet sexually active, so does not need vaccine. So you need to tell them why, 5 reasons why vaccinating at a younger age is better. Like other any vaccine, HPV vaccine is designed for preventing HPV infection. So before the infection actually occurs. Just the way the seat belt is worn before starting the car and not after the accident. The vaccination is advisable at or earlier age before the actual infection occurs. International organizations like WHO recommend HPV vaccine to be administered before the first exposure to HPV infection. People were talking about the antibody response, and I think this discussion in the past has been said that one critical level has to be there. From that particular critical level, if it is over and above, does not make any difference. Immunizing before exposure can give highest possible efficacy. And I did tell you just now that 98% efficacy in preventing cervical precancerous lesions and even cancer is seen if it is caused by 16 and 18 to the tune of 98% as for the cervix is concerned. While 100% efficacy is there for preventing vulval vaginal precancers and genital warts caused by 6, 11, 16, and 18 in the naive woman between 16 to 24 years old. Naive women means who have not been exposed. This question comes time back again. I have a single partner. Why should I take a vaccination? The cumulative incidence of a first HPV infection is seen. At the end of 1 year, 30% are HPV positive. At the end of 3 years, they are 50% are positive. So there is a merit in taking vaccination. Cost immunization can be less in case if you immunize adolescent girls, because here there are 2 doses, and tomorrow when SAGE recommendation will be taken up, it will be 1 dose. So I think there is merit in taking earlier the vaccination, the better. Women over 25 years of age may say, I'm too old for the vaccine. So this particular slide is a very, very important study slide, which shows that from 15 to 45 years, you take any time, the incidence of HPV infection rises throughout their lifetime. And it's also seen that the risk of progression from CIN1 to CIN3, and the cancer increases with age. The risk of progression from CIN1 to CIN3 is 7 times higher for a woman who are more than 30 years in comparison to women who are less than 20 years of age. And detailed I gave you yesterday, but again repeating it just now, quadrivalent vaccine is efficacious even in the mid-adult life. Everybody knows that if it is given between 9 to 15 years, it is very effective. Between up to 26 years, it is very effective. But it is said that even if you take between 26 to 45 years, the studies have been done up to 45 years. But few countries have, I told you, the upper age is no limit, they have put it down, so there must be merit in it. I think that's not the point of discussion today. It is seen that 90% efficacy is there for persistent infection causing CIN1 or removing the condyloma. 92% efficacy is there against ASCUS or a high-risk HPV positive cases. Like anybody who has got 16 or 18 positive, you will not find, in case they have taken a vaccination and come for a regular screening, they will not get into cancers. 100% efficacy is against LSIL and worst form of the conditions. 100% efficacious, it is there HPV 6 and 11, 16 and 18 related CIN and higher grade of lesions and condyloma. I'm worried about safety of the HPV vaccine. So large data, which has been, I told you yesterday that many countries where it has been done, covering almost 30,000 female, and 3 million doses are already given, and which is again 21 data that 3 million doses have been given. And these are big bodies like WHO, CDC, which keep record of each and every complaint of the adverse reaction which is taken against HPV in vaccination. So these are big 9 bodies which advocate the safety of HPV vaccination. The fourth common question from the mother of a newborn is, I'm breastfeeding my mother. Is vaccine safe for me and my baby? Again, this quadrivalent vaccine is not a live vaccine. It's safe for the mother, and no adverse reaction has been found in the baby. And all big bodies like American College, US CDC, WHO, and even FOXI advises about its safety, that it can be used. Fifth question which bothers patient worried about the long-term effectiveness and can say, you give the vaccination at a very early age, the cancers occur at later stage. How a cancer which has been taken how the vaccination which has been taken so many years earlier can protect me from cancer which occurs much later. Again, it is, I had shown that in today's time, it is 17 years since the time the vaccination have come to the world market. It is 100% effectiveness has been there when this study was quoted in 2018. No breakthrough. 0 breakthrough cases. Sixth question is, I think HPV vaccine is costly, and this cost is more in a physician's mind than on a patient's mind. If the doctor can convince that this particular vaccine is good for you, it is good for your daughter, it's good for your wife, then the cost is not in their mind. So the cost barrier is more of the physician's perception than the patient barrier.